Hi, everyone. Welcome. On behalf of Volunteers America, my name is Al Boyce, moderator for today. And today we share our webinar of moral resilience in pastoral care workers during COVID-19. Volunteers America, since 1896, has been involved in the front lines of trying to relieve pain and suffering across the country. We've advocated strongly for anyone in need, present in the moment. For the past few years, Volunteers of America National has been really involved in the issue of moral injury. And with our Vice President of Moral Injury, Rita Brock, we're thrilled that we are making a national impact in this area. So Rita and I were having a conversation just about, I think, the end of March, very early April, as we were planning a moral injury convening for the medical community for New England. And in our conversation, we realized, oh my God, there's so much pain on the front line, and we were really worried about moral injury, and if there's anything that we can do in the process to help alleviate the intensity of it for folks. And so we brainstormed and created what we call webinars on the topic. And so we jam them together every 2 weeks or so, and we invite folks who are in the field to share their experiences and what's happening with them, and hoping in that process to glean ways of supporting folks and each other. And so we've done the medical community, the nursing community, we've done the social working teams, and today we're thrilled to be bringing to you our pastoral care. We have a tremendous panel, group of panelists, and we're thrilled to have them. I'm going to introduce them to you. But before I do, I'm just going to give a little lay of the land. We will invite our panelists to share their experiences around three kind of straightforward questions. One would be, what challenges regarding COVID-19 are you experiencing in your work? The second one is, how do you care for yourself and or others during this time? And what can we, the broader community, do to support the work that you do? Each panelist will have an opportunity to respond to those questions on their own, following which Rita will bring a response and have conversation with the panelists. And all during that time, all of you, every participant, has the opportunity to place questions in chat, and Rita and I will scurry around and try to get them all as best as we can. And we will then present them to the panelists as you ask, and after we will, and you can ask Rita questions. And when we're done, we will just all conflab together and see what we can do to respond as the needs have come up. So with that, I just want to introduce our panelists for the day. Our first panelist is Diane D'Angelo. She's a mental health counselor, hospice chaplain residing in Denver, Colorado. She has extensive training in Gestalt and dialectical behavioral therapies. Diane earned her counseling degree in 1994 and graduated with an MDiv from Iliff School of Theology in 2017. Her areas of interest include recovery from religious trauma and moral injury. Diane is endorsed as a hospice and social justice chaplain by Mountain View Friends Meeting. She is also a board member of the American Friends Service Committee. Clif Genge serves as palliative care chaplain for the Rochester General Hospital in Rochester, New York, providing spiritual support to patients and families through serious illness, and in some cases, transitions to end of life and loss. Clif earned his master's degree from Northeastern Seminary and clinical training at Strong Memorial Hospital. Clif has experience in hospice care, trauma, skilled nursing facilities, and inpatient mental health. A husband and father of 3, Clif is honored to be part of some of the most sacred moments in people's lives. Reverend Julianne Silberman-Bunn is a graduate of Thomas A. Edison State College and Ehrlichman School of Religion. Julianne was ordained a Unitarian Universalist minister in 1992 and served Unitarian Universalist congregations as a religious educator and minister for 22 years. Julianne then worked as a hospice chaplain. In 2019, Julianne and her husband moved to a tiny cabin in the woods of Western Massachusetts. In November 2019, she began work as a hospital chaplain at Mercy Medical Center in Springfield, Mass. Julianne is the author of Chapters in Every Spiritual Practice and Living a Call by Skinner House Press. Adrienne Daniels, LMSW, is the manager of bereavement services for Lifetime Care, Home Health Care, and Hospice, serving 3 counties in upstate New York. Adrienne joined Lifetime Care in 2012 as a community health, palliative care, and hospice social worker. In addition to overseeing the bereavement program, Adrienne provides short-term grief counseling to individuals at high risk for complicated bereavement and facilitates caregiver, cancer, and bereavement support groups. She coordinates the Children's Bereavement Program. Adrienne offers support to Lifetime Care staff through difficult personal and professional losses and provides education and mindfulness practice to reduce the effects of compassion, fatigue, vicarious trauma, and moral injury. She received her education from Penn State College and Roberts Wesleyan College. Dr. Khadijah Matin is Associate Director of Education and OLD for Faculty of Spiritual Care and Pastoral Services at NYU Langone Hospital in Brooklyn, New York. She also has shared the journey of services, which has included works in the field of education, health, and nonprofit development for over 40 years, exploring culturally competent and, when appropriate, spiritually determined models of wellness and learning. She has served as advisor and faculty to chaplains and other service providers. This work has been supported by a master's degree from Fordham University, a Doctor of Ministry degree from the New York Theological Seminary, and becoming a Rothschild Fellow, and staying connected to community with membership in the Association of Muslim Chaplains and the Afro-American Historical and Genealogical Society. We are thrilled to have all of you with us as panelists today, and we welcome every participant to our conversation. With that, we will happily begin the panelists sharing with us today. And so we would begin, of course, with Diane.
Good morning, everyone. It's great to be here. And greetings from sunny Denver. I'm honored to be part of this panel and to see so many folks interested in the topics. I reflected a lot in the last couple weeks on the questions that Rita posed when I was invited to participate. And my answers are different in many ways almost every day, which I think is a characteristic of this era we're going through. The challenges that we've had for my staff at hospice, I'll go to staff first, has been the rapidly changing scenario of this pandemic. What was true last week is not true now, and riding those waves of change. I've had my position as a hospice chaplain before the pandemic was maybe 25% pastoral care and support for my peers and 75% with our patients, which is what you would expect. That has changed. I would say that it's more 50-50 right now of providing pastoral care to my peers on my hospice team and caring for myself during these times. The second question, let me add to the previous question. The other challenge certainly has been with my patients and their families, specifically the way the pandemic has played out in nursing homes here in Denver and across the country. Families have been isolated from their loved ones, and that has been a heart-rending experience. Some of the most difficult work I've done. I had an experience early on in which I had to call a patient's wife who was suffering from COVID as her husband was dying in the hospital and she was unable to be there. That's really hard. And being creative with family members who are at home who've been locked out of facilities and dealing with their existential challenges during this time. It's something that we haven't encountered before. So it's required new strategies. Insofar as my own self-care during this time, I have found myself getting deeper into contemplative practice. I am a Quaker and heavily influenced by Buddhism, and there are many days when I come home from work and I journal and I meditate. I've leaned back from participating in social media. I see a trauma therapist a couple times a month, and find myself doing more things around the house. I've planted a garden, looked into some craft work, that kind of thing. But really leaning into my religious tradition has been tremendously helpful right now. And I think the last question was, what can the general public do to support folks right now, frontline workers and specifically pastoral care providers? And I think that's twofold. There are concrete things you can do. My Quaker community opened our meeting house to frontline workers as a place to stay so that they wouldn't infect their families. That's been going on for a few months now. We look to be shifting away from that, but that's been a tremendous support to the community here. And, but I also think that having people check on me has been a wonderful, meaningful experience. The phone calls and an awareness that frontline workers need help beyond being called heroes. So that's my response to those questions, and carry on. Thank you.
Thank you very much, Diane. Much appreciated. Clif?
Oh, there I am. I was talking to myself apparently a minute ago. Okay, first I just wanted to say that I'm really honored to be a part of this. I'm very grateful to be on, and it's the the COVID, I guess, pandemic and crisis has really hit home for me in a couple different ways. It's literally hit home in that, like, during the course of my time serving here at the hospital, I contracted the virus and was able to recover and come back to work, but my wife and daughter were also infected, so that was created a dynamic of, you know, some stress and anxiety and you know, some guilt feelings and that kind of thing to cope with. But, you know, more so even professionally, there's been a lot of challenges to the work that I do. And I see some new challenges, but I also see other challenges that were just magnified. They were there before, but people coped with them a little bit differently than they have to now. I look at a lot of times in my regular work, people come to the hospital, and throughout the course of their daily lives, before something happens, they're coping with some things that they're not even necessarily aware of, but they're carrying a lot of different things. It's kind of like a sack that sort of flows behind them. And then the hospital happens, and all of a sudden there's that brick wall that they run into and they're stopped. and the momentum carries the rest of that stuff with it, and they're faced with a lot of challenges they didn't expect. Well, the pandemic has really created that and then magnified that as well for not just the patients, but also for a lot of the people who work, myself included. Some of the new things that I see that we're faced with was the isolation. With the staff, initially it was nice for them to be able to do their work, and they felt like there was a little newfound freedom that they had with doing their work. But after a while, that they kind of realized and sort of felt like this isn't normal. There was an uneasiness to not having families in and out and coming and going. But even too, with the patients, it creates a lot of additional needs in the patients for me to attend to, because I mean, you have couples that have been married for 50 years and they literally haven't been apart for 20 because they've been retired and doing everything together. And now all of a sudden they're apart and they don't know how to cope with that. And, you know, there's tearful visits with the family member in the hospital, and essentially coordinating phone calls and things like that, where you're also experiencing some of the separation from the family as well. I mean, obviously there's the physical challenges of the putting on and the taking off of all this stuff, and the added, I guess, heat that's in the rooms and things. But there's the mental challenge for me too, can get frustrating, and for a lot of the staff, because you have policy changes. It seems like there was a time where it seemed like every day there was a new policy, and some of it contradicts some of the things that you were trained to do. If you take a look at, like, you know, we were supposed to always make sure you take on your stuff, put it off, take it back off before you leave the room, and you throw that away. You don't reuse that mask, but, you know, now we have a mask a week kind of a thing, and that can create some anxiety and frustration. Or just the sheer visitor policy that seems to be changing a little bit here and there, and as that goes, you know, one unit might have a different view of the policy than another unit, and it gets frustrating that you're advocating for a patient on one unit for the same thing another patient has on another unit, and it just doesn't work out. So there's coping with that, and I think my role in care changes a little bit, because I'm facilitating a lot of things that I wasn't really a part of before. To give you an example, we had a family that I was very connected to, and they would have been the kind of people that would have come in and had conversations with their loved one they were sedated and intubated, but they would have come in and probably sat by that person's side and you know, pleaded with them and pleaded with God for that person to recover, and they would have been able to talk to them or read the letters they had written to them. But, you know, instead, I became that conduit. So, you know, a few times a week, I carry in the phone and I listen to, you know, the tearful family pouring out their heart to the loved one, and the pleas to God for him to recover and things. And that's a new experience for me and a new challenge, because I then carry that out of the room and end up in a different kind of a relationship with the family. You're almost like this silent adopted member of the family, because they have to trust you a little bit deeper to relay information to them and to tell them, you know, what's going on with the patient and in the room. And that's more than just a medical update, but that's, you know, that addresses their feelings and their emotions that they're pouring out. And I also see, given that and the fact that I myself, but also the nurses, are facilitating a lot of those things that they're not a part of, I see a lot of more magnified moral conflict, I would say, or moral distress, because, you know, well, again, to give you an example of that same family, I was going in and coordinating all the calls and things, but, you know, the nurse would say to me, I don't understand, this particular family didn't want to see the patient, they just wanted to verbally talk to him. They thought it was just too hard for them. And the nurse would regularly say, you know, I don't understand, I don't want to see him. If they would see him, they would just understand. And she said, I feel like I'm hurting him every day. I feel like I'm just doing more harm than good. And the particular patient was COVID positive. And she said, and he's still full code, and I have to go in there and code if his heart. And there were tears rolling down her face as she said that. So I think that's an added layer of some of that was there before, but it's more so now because the family's ability to process everything that's going on is inhibited. So therefore, and the nurse and myself are brought into that. So therefore, I think it just creates a lot more stress and anxiety and moral conflict and distress in them. Which probably is a great point to transition to self-care, because with all the extra weight, you know, I found that, truthfully, my go-to used to be just being involved in my family. I have 3 kids that are all active and have things that they do that are really a good escape for me, but also, you know, in playing the role of father and husband, it helps me to refuel and get ready for work, and to go back to work with the right kind of attitude and mindset and be grounded. But early on, and with all the extra things, I sort of felt it spilling over and detracting from my role at home. And I felt like I wasn't ever getting rid of the weight, whether it be of work or home or whatever the case may be. And I started to realize that I need to be just more mindful during the course of a day, and realize what's going on. A while ago, I was in a conference, and one of the doctors was talking on mindfulness, and it was a simple thing that I picked up on. And he would say, you know, in each time as I go through the day, whenever I walk through the door or I touch a door handle, he would say, but we don't always have door handles here. He would say, but I would stop before I go through the door, and he'd say, where are my feet? So I don't necessarily do that, but what I do is at times when I'm starting to feel things get a little bit overwhelming, I'll stop just for a minute and say, okay, where am I? Not where am I necessarily physically all the time, but where am I emotionally too? Am I ready to go into that next room, or do I need to just take a minute? Maybe chart a note, maybe say a prayer, maybe just sit for a minute and have some silence. The other thing that really has come into play, and it really stems a lot from the deeper relationship I feel like I gather with the family being that conduit for all of their connection, is to really learn to honor the different moments and the connections and the feelings that I'm having in the moment. You know, a lot of times there is anger and frustration, or you might be overwhelmed just based on what's going on, and just taking a minute to either talk to a peer or I guess talk to myself and just sit quietly and say, yeah, I am having that. To also take a minute to recognize the joy that comes with some of the appreciation that I am given during the course of the day. I think, you know, people will say, hey, thanks for coming in. Nurses really appreciate that I'll take a phone into a room, that I'll visit a patient, because that's one less thing that maybe a family might be asking them to do. But the other thing that hit home, especially with this particular family I've been referring to, is I had facilitated so many calls and heard so many conversations and said so many prayers for them that it was the final day, when he was having his final day and the family had finally decided that it was time for him to comfortably be able to move on and, in their words, go home. You know, they all I had 3 different calls that I was able to do with the family, but at the end of the day, I felt like I had to go in and say goodbye to him too. So to honor that relationship that I had with that family and the patient, I went back in and had a conversation with him and said a prayer, just blessing his moving on. So for me to come to that realization because of everything that's going on, that I think it's important, and it's important for all of us to honor all of those feelings. I say a lot of times our emotions are like little kids. If you pay attention to them when they come up, then things will be okay. If you don't pay attention to them, then they just get worse until you do. And the last question was about how can we help, or how can people help us? And I really kind of broke it down into the 3 different things that help me help other people, but that also help me in return if people are kind of returning the favor, I guess, so to speak. One thing that I probably heard from a coach along the way, but said the best ability is availability. And that's what I would say, is be available for each other. It's nice when people are available enough to just check in with me and see how things are going. And vice versa. I think when I'm available, when I'm on the unit, when I sit down next to somebody and say, how's your day going? That I'm presenting an availability. And I would say too, that we're all pre-programmed to say, how's your day? It's fine. It's good. I'm fine. Well, I would say too, if you're really looking to be available for that person to help them, or if you're looking to be available for me, don't take the canned answer, the one that you're always going to hear. I guess what I do is I'll just say to them, are you lying to a chaplain? Which generally is met by a chuckle. But oftentimes too, if they really are kind of just giving you the canned answer, they'll say, well, kind of. It has been a tough day. It's been really hard. I've worked really hard, or I'm on my 12th hour or my 4th double or whatever, and vice versa. If somebody will sit in for that follow-up, I will share what's going on. The second thing I would say is that is what helps me and what seems to really help people is being grateful, appreciating the work that's done, the efforts that are being made. I think, and not just passing by and saying thanks. I think it's important to emphasize it. Sometimes, you can pause. I'll pass an environmental services worker who might be, a guy yesterday. He's working really hard. He's got his mask on. The sweat's rolling down. He'll say, and I said, hey, thanks for doing that. And he said, you're welcome. But I stopped and I said, no, really, you're working hard. This is a lot of different stuff for you. So I'm glad that you're here working with us. And that goes for everybody, for environmental services, for the transportation people, the nurses, and the chaplains, of course. And the other thing I would say is just notice the effort that people are putting in, notice the strength that they're showing, and notice the resilience that they have. I brought a smile to a nurse's face yesterday, and when I just said, hey, I see you working hard over there. And she just smiled and said, thanks. And it means a lot to me. Yesterday on the way out of a unit, I was passing by the nurse that I just visited the patient. She said, hey, thank you for going in there. I stopped for a minute and said, you're welcome. And that gave me a little bit more lightness to go on to the next thing. The last thing I just wanted to close with real quick is that there are a lot of things that we're coping with right now that are challenges, but there are also some things that we're learning that we should carry forward. I think as I walk around the hospital all day with the masks and things, it reminds me, because I can't recognize people all the time, it reminds me that we're a lot more alike than we are different. And maybe we can learn to appreciate that a little bit more. To appreciate each other and know that Mother Teresa said, not all of us can do great things, but we all can do small things with great love. Appreciate that we all can do those little things. And the other thing is that as we come together as a team through this, remember that even as we come out of this, we're all better together. I think it was, actually I can't remember who said it, but I think it was maybe Anne Frank, but she said, alone we can do little things, together we can do much. So I guess I leave you with that. I hope it's helpful. I'm really, again, grateful that you allowed me to be on the call. And God bless you all.
Thank you, Cliff. We much appreciate. Thank you very much. Now we'll move to Julianne.
Well, so much of what both Diane and Cliff said rings true. In my own experience, the thing that I am really struck by is the challenge of not being able to use touch. So much of what I do in my life, even and work as a chaplain, is holding hands, being physically present with people, hugs. And we can't use that in this time of COVID. And so it's really forced us to turn and learn how to rely on other things. And one of those things that I am so grateful for is that in the first few weeks of the COVID pandemic, we didn't have access to technology. We were finally given iPads on all of our units, and we can use the iPads to communicate with families and with patients. The greatest gift of those iPads, and at times the greatest challenge of using them, has been at the end of life. To be gowned up in those horrible plastic gowns with our masks and the shields around our faces, and being the intermediary. Clif was talking a little bit about that, about how we are present with the patient and the family can't be. And I had one very intense experience with an African American family who came out of a Pentecostal tradition, and they were singing gospel hymns and offering prayer as they were sending their father and grandfather off to heaven. And the intensity of that intimacy with that family and that patient was both an enormous gift, but almost made me have a sense of voyeurism into this time that should be just between the patient and their family. And we are in this strange time where we become an integral part of that. And that is often the reality for chaplains, is that we find ourselves in places opening doors for spiritual interaction with families that they might not have had otherwise. I used to be a hospice chaplain, and just even telling people it was okay to hold the hands of their loved ones, and we can't do that now. We can't tell people that they can touch. We can hold the screen and show them the hands and show them the faces. But, we are that one-way mirror into the life of the person who is transitioning. And the blessing on this has been the rare occasions when somebody does pull through and come from that place of death's door to eventually being able to leave the hospital, and the intense joy that we feel and the family feels, and that turnaround. And also there's a confusion, I think, for some of the families during that time, because here they're hearing from the doctors, this disease is taking him, it's horrible, it's, we're saying goodbye. And then over days, sometimes weeks, the person may come back. And so there's a confusion, and we as chaplains have to remind people that, there is only one creature or being or entity that has all those answers of when the end is. The rest of us are guessing. And even the most skilled doctor is only ever guessing. And so we have that role to make that communication between the family and all of the medical staff make sense. Oftentimes we find doctors are talking in medicalese, and families don't always get it, especially families who are not first language English speakers. And we have a lot of those in the community that I serve. And so, that's a whole other part of this is in our hospital, most of our translators and interpreters are not present now. And so we are stumbling through some of the language barriers, particularly with COVID patients, in ways that we have never had to do before. So that's very challenging. I do want to go back to what Clif was saying about taking stress off of staff. You know, even in little ways, I always say to people, the nurses, the aides, the doctors, they come in with a purpose. And right now, the thing that has fallen on our shoulders is not just making pastoral visits, but being the only link, the only visitor. And particularly when someone is having a long stay, because right when COVID started, the hospital closed to all visitors, all pastoral visitors, clergy from the community were not allowed in. So we took a big step forward in being the pastoral presence, but also being the human face that people who are extraordinarily isolated are seeing. And we are the ones who have the time in our day to sit and listen to someone's story and give them just human companionship at a time when they're not getting it. And we see that particularly with our elderly patients who don't have technology. They don't have a smartphone. They don't have an iPad. They have not seen the face of a loved one in a long time. And again, some 7, 8, 9 weeks, sometimes more at this point. And we are able to bring that technology, the iPad, in and let them see their family. And the utter joy that we see is such a gift and really is one of the things that lifts my spirit so frequently. And I think those are some of the biggest challenges. For me, some of the things that de-stress me, I have the wonderful opportunity that I live in the middle of nowhere. I live 2.5 miles in on a dirt road in the middle of the woods, 6.5 acres, surrounded by 500 acres of conservation land. So that is my blessing and that is my sanity. My ride home is through beautiful scenery, and it really gives me an opportunity to transition from the hospital community here to the woods. And as was said in my bio, we moved here in the fall of last year. So we've only been here about 8 months now, and we downsized from an 1,800 square foot house to an 800 square foot cabin that was already fully furnished. So we've had nonstop downsizing going on in our lives. So there's always something here to do. And we're turning a tiny little summer cabin into a forever home. So we're always working. So there's always that for me to turn to. But the thing that I have taken deep solace in is deep breathing. I make a point of doing deep breathing exercises with my patients who are anxious, with some of my staff who are just overwhelmed, and I do it before I enter a hospital room and when I come out. I make sure I take at least 3 deep, healing, restorative breaths so that I am grounded in the place where I am. And like Diane said, my seminary background was in the Quaker community, so I got very used to seeking the divine in those moments of silence. And even just a brief moment of silence can be very powerful, very healing, and very calming. And for the final one, what kind of support would help us? I found out on Friday our hospital president and medical director announced that they are going to provide a space within the hospital for renewal. And they were asking for what people wanted. And what I kept hearing was fountains and koi ponds. But I think there's going to need to be a lot of other stuff. And so any ideas for a room in a hospital that staff can go to and get off units and just have that breather, I think is going to be a huge help. Increased staffing. You know, one of the challenges we have faced is not only do patients get COVID, but the staff have gotten COVID. And so we are down staff who are out with the disease. And so I think many hospitals are feeling short-staffed as we go through this. And, you know, if you know nurses who are retired, who are willing to come back into the field, hospitals are looking to bring extra trained personnel back on, and it would be a huge benefit. And the thing that makes the biggest difference for me are just angels, human angels doing acts of kindness, and actual little quirky handmade angels, which I collect. And along those lines, the congregation that I am most closely related to had their youth and some of the adults make cards, handmade, hand-painted, drawn cards that they brought and left with our security that I could hand out. And they just were to the nurses and to the staff. And I can't tell you, I mean, we get all of these, you know, oh, we love our first line essential workers. But when I could hand a nurse a handmade card that said, thank you for all you are doing, the sense of honor and being seen that these people had was enormous. And so I encourage everyone, if there's just little things you can do, please do them. One-on-one to individuals, send them to the chaplains. We're happy to share. So thank you.
Thank you so much, Julianne. We really appreciate your presentation. And now we move to Adrienne.
Hi, everybody. I just want to say thank you so much for letting me be here today. And I feel immensely grateful that I can be here to support you in all the amazing work that you're doing in your vocations and sharing your love and compassion with other people. And this is just crucial. It's just a part of my being. So I'm grateful to have this. I wanted to share a little bit about the perspective from our bereavement side to kind of give an idea of what our hospice families are experiencing after loss right now. I can imagine that a lot of you are also providing bereavement support. So just to kind of center ourselves and know where we're coming from and what we're being exposed to is important. So obviously the inability to be present with our loved ones or spend adequate amounts with them while they're dying has a long-lasting impact. Our loved ones, even on hospice, are more likely to die alone, unfortunately, which is really, really hard for our families to experience. There's inability to assist in the work of dying, so families are having a harder time coming together in large groups to surround somebody with love and compassion and share memories and life review to help them. And that has a healing impact on us after our losses too. So families are kind of being deprived of that opportunity. People aren't having the same amount of access to hospice care as they were before. People just aren't going to the hospitals and necessarily signing on to hospice. We aren't able to provide as much support as we would like to amidst the pandemic. So I think that's also important because all the support that a family receives from all the disciplines has a healing impact as well. So what I'm experiencing in my work, not only with COVID families, but also hospice families in general, is that guilt is a very normal part of grief, but it seems to be exacerbated right now, especially role guilt. So a lot of people are not able to be present with their families in the hospital. They're not able to advocate for their loved ones. They can't control the situation. And that is a weight that they carry with them. Like, I love my wife. I was supposed to be there for her and I wasn't able to do my job. I failed her. And it's so immense right now. So it's important to keep all that in mind. Our dying loved ones aren't receiving the spiritual support or the sacraments that they request or want before their death. And also families are not receiving the spiritual support that they desire after the loss. So a time when we need our church families and our clergy the most, we are just kind of deprived of that. So I think part of that kind of puts a burden on you, because sometimes you are the only person that has access to these families. And I think that's important to keep in mind, that it's a heavy burden for you to carry. And then also, to kind of bounce off what Julianne was just saying, physical presence and touch are so important to these families. Touch is grounding for us, and when grievers aren't able to experience that, it kind of is, it makes their journey a little bit more challenging. So I do feel like we are just starting to see this. Typically, people reach out for bereavement services about 3 to 6 months after their loss, and people are starting to call and recognizing that their journeys are a little bit more challenging than they thought it was going to be. And also on top of that, we're not receiving the funeral or burial rights that we would want, and that can put a little bit more on us as to how we can help these families facilitate that that healing and that mourning activity that they need and so desire. So bereavement programs and chaplains are trying to be a little bit more creative in how that we can help support that even down the line after the loss. How can we share their legacies? Oftentimes people feel that their loved one just disappeared and they didn't get the recognition that they deserved. So often the first question that people are asked is, how did your loved one die? Do they have COVID? And it just kind of invalidates their experience and their loss. So just to be mindful of that. So what are bereavement professionals experiencing? We're hearing all these stories, and we have our own experiences and losses with COVID. I just did an exercise with staff where we did a loss line to kind of pay attention to what our life losses were like, whether physical or experiential deaths or changes and transitions in life, and then to kind of open and expand it to what the experience is like through COVID. And it's pretty amazing when you put on paper all the losses that we're all experiencing right now. And it's important for us to be aware of that, because we're carrying the grief that everybody else is experiencing at the same time that we have our own. So we're also finding that our calls and our counseling are more intense and have additional layers. A lot of people need to work through what they're experiencing with the pandemic as well as their losses. The increased isolation and stress from the pandemic is also creating challenges to maintaining emotional, physical, and cognitive health. And so sometimes we are the only people that really have access to these hospice families and grievers afterward. So we carry our own grief. We're listening to theirs. It's very intense right now, and we are at greater risk of vicarious trauma from hearing these stories and carrying that. There's a lot of research coming out now, just at the cusp of it, about how, I'm calling it virtual fatigue, but how much more challenging it is for us to do this over the phone or via Zoom than it is in person. I suspect that part of it is because our brain is having a more difficult time processing what the visual cues and the body language when we're over Zoom than we are in person. So what are we doing to help with self-care, and what am I doing for myself? To bounce off of what Clif said, I think that these issues have been here for a long time, but COVID brought them to light. So if there's a silver lining, so to speak, I know we're hearing that a lot lately, but I'm glad that we're talking about this now, because a lot of the challenges that medical professionals are coming to me don't necessarily have to do with COVID alone, but there are things that they have been experiencing for years that have just been mounting. So I'm glad that we're actually taking the time to take care of ourselves. This is an ongoing storm. For many of us, it's kind of settling down at the moment, but I suspect that we might be in the eye of the storm, and we're being told that this can change at any moment. So let's take this time now to put on our oxygen masks and take care of ourselves so that we can take care of other people. It's about agency change and health system change. How can we better support each other? What can be in place to support our staff and to support that space that we were talking about, like setting up a room. Lifetime Care offers mindfulness sessions every day so that people can call in and just have a moment to center themselves and ground during the middle of the day. Providing a lot of education and skill development to build resiliency, to help cope with compassion fatigue and moral injury. A lot of this has to do with body and emotional awareness. Again, Julianne was talking about grounding. I am very big into grounding. I've always felt that people who are grieving, who are yearning for their loved ones, feel a sense of detachment from life and reality, and they crave things that kind of make them feel grounded. So that touch, being outside, gardening. And there is research that shows when we can walk barefoot or be present in the grass or have our hands in the dirt, it actually does help us. It reduces inflammation and takes us out of a sympathetic to a parasympathetic state. So grounding is important, and it's also called earthing. There's a lot of information on that if you want to learn some more. So that's why mindfulness-based stress reduction, Mindful self-compassion is another great tool for learning these skills. Just learning to take a moment to place your hand on your heart and take a couple of those deep breaths and recognize it as a moment of suffering can be very helpful for us, just to take that pause. EAP programs are really great. I know that Rochester Regional Health is their psych department is offering some support for staff who are going through moral injury and compassion fatigue. And allowing ourselves permission to grieve and recognizing the losses that we have. So often we just kind of zoom past our own when we're working with other people and helping them. Another helpful technique is creating a boundary in a transition. I've heard that a couple times today. Creating that transition from what we're experiencing at work before we step home, that can be really chaotic. And for me, for example, I like to take a moment to just wipe it off in my office, take a couple deep breaths. For those of us who have a long commute, take that time to just kind of nurture ourselves and take the breaths and just kind of process what we've been through and kind of transition into our life with our families and what's going on there. For me also, just a personal thing, I'm an Orthodox Christian and my faith is really important to me. So I have a spiritual father who helps me through a lot of the grief that I'm carrying for other people. And I can't stress that enough. If spirituality is important for you, to be able to nurture that peace for yourself and find those that you can talk with that are on the same line and just kind of help each other process through this. And another final point so that other people can talk to, I think that something that is really crucial in healing from moral injury is advocacy. And this was also mentioned a little earlier. What have we learned so far? Like, we are in the front lines. What is working? What is not working? What can we do differently? How can we advocate even within our systems or at the government level? Like, how can we be a part of change and moving forward and kind of adapting as we go along? Even using trauma-informed approach and language can be really important. The impact of PPE on us and on our clients is huge, and even our language. So, like, for example, using the word social distancing can have a negative connotation for people. So I prefer to use physical distancing. That's from Dr. Ken Doka. Essential versus non-essential. Like, all people, especially if they're suffering the loss of their livelihood right now, are feeling that. And a new normal, that can be really scary to hear that word when people are suffering through loss so much. So just creating that change within our friendships, within our systems, with each other, with our clients can be really, really helpful. And to check in with each other, that's really important. So thank you.
Thank you very much, Adrienne. And then finally, Khadijah. Oops.
Sorry, I forgot to unmute. So I guess I should say to everyone, I bring in a slightly different role to this process. And I think it is a way to see that the role of the chaplain is not just in terms of patient care. As an advisor to chaplains and as an instructor, I'm often trying to help them see their role as an integral service provider to whoever they encounter. So it might be patients, but for some it might be the staff, or it might even be a corporate environment. The hardest challenges that I'm facing in this COVID era has been working from home. And I have to preface my remarks by saying just a couple of months prior to all of us having to change our lives, my youngest child, who was 41, passed away due to cancer. And it made me totally have a paradigm shift about how I saw the world, how I saw my purpose, and how do I continuously honor the opportunity I had to be her mother. So that had a deep impact on how I saw suddenly we're on quote unquote lockdown, or we have to work from home. I immediately had to make the shift and not see it as I'm being deprived, but there's a blessing in that, I have a home that I can be safe in. And then it made me begin to look at, how do I make my work meaningful? So the first thing I had to do was to ensure that the computer and the Wi-Fi and the technology I had was sustainable, because we didn't know if it would be a month, 3 months, 6 months, or perpetually. So it also meant that because working in ODL and HR, I had to take on tasks that were not typical to my job. And it was an incredible opportunity, because I was responsible for those helping to assign staff to work in the COVID units and other related areas outside of their typical job titles. And so I had the opportunity to talk with staff over the phone, coaching them, listening to their concerns, being that safe place that they could express themselves, and then helping them find the way, being the transition to help them find the way to accept the responsibilities and to step into the new roles or the slightly different ways, or to continue working in a time and a place and with equipment that we had never quite had to go to before. I also wanted to point out that I helped a lot of people see that the grief, that the people that were making the transitions in front of their eyes, the stories that they were hearing, the things that they were reading on the news, I would actually advise the staff that when they left work and made the transition back home, to not spend the evening listening to the news, to give themselves that respite. And I also did that for myself. Sometimes the days were long, working virtually or on the phone. But when my day ended, I turned the computer off and I would go for a walk. I'd put on the mask, I'd have on my gloves, and I would go for a walk, at least 20 minutes to a half hour, just slowly walking and breathing and bringing myself back to that center. The other thing I wanted people to understand, what I learned, is mourning is not chronological. It's not going to happen that you get over it, and that the grief is going to show up in cycles. And I would refer colleagues and the chaplains back to, what did we learn in our scriptures, but what have we also learned in the other books that have informed us, such as Kubler-Ross and all the others, about the cycles of it, so that we could see within ourselves what are the small ways that we're grieving. Because everyone would say, I want to get back to normal. Well, maybe normal wasn't all that wonderful. And is this an opportunity to really revisit how we coexist as humans and creating a different and better environment? How do we treat each other sustainably, and in Islamic terms, within a green deen, within the essence of our faith and beliefs? So my role is not patient-facing, but my role is I'm in touch with staff. And I also contribute to how a lot of general, basic, and new trainings are developed. So sometimes I would raise the point of, well, how will this help this person do their job better? How will it put them in touch with their humanity and the person that they're working with? When we had to find staff that were really being stressed, we had to remind them what are the internal and external services and programs that are available. So it wasn't something I did on a regular basis, but now it was something I did on a daily basis. And so then I had to turn that on myself. And so you asked, what did I do to cope with the stress? My daily walk, my grounding in my faith-based connections, both within the interfaith community and within the Islamic community. The advantage of having so many programs and services over Zoom was that I could participate, for instance, in my Friday Juma services more regularly because we could do it over Zoom. I could assist in memorial services for those who were deceased as a result of COVID, and who were not able to have anyone to pray for them, or who could not afford to have regular services, however they were modified. And so there were groups of us who, through our various faiths, developed memorial programs, and just participating in that as a group was rejuvenating and reassuring, and actually revitalized for me, what is my purpose? How does my spirit walk through everything I do? And it even influenced how I was cooking at home. You know, I'm the only one in the house. So what am I eating? How am I nurturing myself? Rediscovering recipes. And then telling my son, come do a drive-by. I baked a carrot cake, or I baked an apple cake, or I've done something else that I know they love. What I saw was this time was not a time to be of deprivation. This was a time in which I was absolutely blessed to not have COVID, to be safe, and to be able to reach out to people in ways that I had not done before. Look at this, I'm talking to all of you. And how would have this had happened previously? Would we have been able to be enriched by each other from so many different walks of life? I want us to think about, and as the previous speaker talked about, bereavement. One of the things I asked for to the providers when they were caring for my daughter in her last stages, I said, I want her to have a good death. And so when people ask me, what do I do for the patients that I'm encountering? I said, how do we ensure them that good death? How do we ensure that their passage and transition will be one with as peaceful as we could possibly do it? And then I asked myself, now how do I do in my life that honors that I'm able to witness so many others? And so I've gone back to my writings. I've gone back to my research. I am working on a book that looks at the faith journey of the African American from 1619 to 1880. I'm looking at what do we have, and this resiliency that we have as African Americans is not just because we were slaves, we were enslaved, but rather what are the roots of that resiliency well before that? And so part of my staying grounded is how do I honor my ancestors? You know, my families were homesteaders in Nebraska. I live in New York. I've raised children. How do I honor all those different roles, and how does it continue a social justice meaning in everything that I do? And so you asked, what would I like others to know about supporting? I guess it's for every one of us that could be in a policy-making position to think about not only the chaplains as, oh, that's the pastoral care or those folks down the hall in that room, but that every single one of us, in a way, is a chaplain in how we aid whoever we encounter through the course of our day. Whether it's the good morning that I give the security when I walk in the door because I need them to do their jobs well, whether it's the environmental services or the dietary workers that I've come to know by name, or whether it's the clinical staff that I am helping to develop materials to help them do their job better with less bias and more awareness of our human experience. I would like for all of us to see that the role of the chaplain far exceeds just the patient. And to use the example, like at our institution, where we do have meditation rooms, we do have a non-denominational chapels, we do have small masjids and Jewish prayer rooms, where we do have places, regardless of anyone's faith, to go and collect themselves. It's how do you have a whole environment that will support all of that? So it's not just something that we happen to do, but it's an integral part of how we can look at what's the nature of our work. How can you influence all that you serve in whatever job you do? And let us all be socially conscious about how we think about that serving. You know, when we were initially told, well, now you have to work from home, Someone says, oh, it shouldn't be that bad. You can go out in your yard and you can do this, you can do that. I live in an apartment in Brooklyn, New York. I don't have a yard. So what are the ways in which you would tell me to live better, to manage, to see that being home can be a safe place? Well, what my sons did was make sure I have more plants and make sure that, you know, I heard from people, and I work in the sunniest room in the apartment, so I get my vitamin D. But it's really, for everyone that we encounter, our environments are different. How do we help them see that? And finally, when we talk about reaching out to our sacred texts, I encourage that regardless of what you read, whether it is your faith sacred text, or whether it's a mystery book that has an incredible journey, there are sacred messages in all of that. And there are ways to remind us to be human. That's what I think we can work with every day. Thank you.
You're on mute, Al.
Yeah. Thank you, Khadijah, and thank you everyone on the panel who has just shared so candidly and authentically. We so appreciate your taking time and sharing. Just before Rita provides the response to the panel, I just want to remind everyone who's participating that we have been following the questions and we will raise them in a little bit. And when Rita's done, perhaps she'll give me the heads up that it's okay to do that, or we'll do it together. And so I just remind everyone of that. And so now we'll move to Rita to respond to the panel and interact as she feels appropriate.
Okay. So is this, okay, we're good.
You're
All
fine.
right. I'm fine. All right. I just want to thank everyone on the panel for a really terrific set of comments and observations and insights. I really learned a lot about the nuts and bolts of the kind of things that people have been facing. And as many of you said, some of the challenges are not new, that we have been seeing more and more literature on the reality of what we call moral injury in medical caregivers for some time now. It's not something that COVID has created, but it's certainly been put on, brought up to warp speed during COVID because the crisis is just case after case after case of failure. And those are things that are difficult to face in professions where people work their hearts out to get good results and then fail it so many times not to have those results. In addition to working within systems that don't always meet their needs or provide the kind of backup support that they feel like they need to do their jobs well. That's been, of course, a major problem for months around PPE. But there are other things too, even the support of people who should be having their backs and are themselves unable to be emotionally present to their own staff. So the fact that so many of you are not only doing frontline work, but also caring for others that you work with, and also for yourself and your family is a major thing. And I respect so much that you're all managing to do this work and maintain yourselves so that you can keep doing it. So I wanted to say, I just wanted to tell a story from very early in my life that it made me aware of how people face grief and bereavement and loss in very different kinds of ways. And it was a story that I heard in an advanced philosophy seminar in my senior year in college. And it was taught by a man who had been a hospital chaplain. He was both a minister and had a doctorate in philosophy. And he was working in a hospital at the time that Elizabeth Kubler-Ross was doing research on her book on death and dying, which now is a major work. And at the time he was involved, he was recruited to the team, the care team that worked on that book. And he said that the story that haunted him the most from all that research and work that he did in the hospital was at one point they had a person who was in ICU and not well, and was clearly not probably going to make it. And this person was a member of the Romani group from Europe. People use the term gypsies for them. They're a particularly discriminated against subgroup in Europe. And this was in the United States. They had emigrated to the US. But in that tradition, he said that they believed that a person needed to die with their family and friends around them, or their spirit would be wandering the afterlife all alone and be unhappy forever. And so because this person was in ICU, of course, the number of people that could visit him was very limited. And unfortunately, at some moment when none of the family happened to be there, he died. He coded and died. And so when they arrived, they were utterly devastated, not only that he had died, but that he had died without them and their community there to see him off. And he said the hospital staff really didn't know how to handle that level of distress. And so they did their best, but he said he felt like it was wholly inadequate to the level of bereavement they were experiencing. And he had just hoped that when they left the hospital, that they were able to go back to their community and find some comfort there. But I think that's part of the thing we're facing in some ways is what that family experienced in that one moment, is that now practically everybody is having to die without that support and community behind them. And so it's added to the layers of loss and bereavement that many of us are experiencing, even vicariously hearing about those stories, not to mention if we've had our own losses during this time. And I know many people have. And I think that the issue that's why I'm concerned about what's happening is that the moral distress, the sense that there isn't enough that one can do, or that it's inadequate, or that you failed somehow your best expectations, can be personally quite devastating. And especially if you're trying to do your best and people aren't responding, or your best isn't working, it's not good enough to do what you expect. You can go down an emotional spiral that leads you to a place of hopelessness, exhaustion, or despair. And I think our panelists have been wonderful in the kind of suggestions they've given for that, for compassion fatigue, for the exhaustion of empathy, for all the ways in which the work can be wearing. And Volunteers of America right now is in the process of testing in a small way to see if it works. Another service that's a peer specialist program that's an hour-long chance for people to actually unload some of that moral distress so that they don't have to keep carrying it. It's called REST, which stands for Resilient Strength Time. And we hope in about a month or so to be able to make those groups public after we go through the pilot phase to make sure they actually are helping people. But there are a couple of things I wanted to say about what people said that we've learned from working with veterans who have moral injury in a program that we ran a pilot for about 2 years. And one is that the mindfulness breathing is so important, not just for the sympathetic, the heart, brain, mind, lung system that uses breathing to reduce the cortisol in your system. It actually will help you reduce the levels of stress you're feeling. But there's something about that kind of breathing that pulls you back into the present. And also, which is really grounding. That's part of the grounding function it has. Because if you're paying attention to your breath that carefully, you're paying attention to what's happening in your body, you're also present in space and time and not in your head perseverating about all the things that you're upset about. But there's also something we've discovered around that quietness of breathing, that time of silence, that actually helps you listen to yourself. That there's a kind of way that stress makes us frantic, and our minds are busy jumping around trying to figure out how to deal with it and stop it. And moving into a breathing space of silence actually helps you become aware of how you're feeling in a way that doesn't mean those feelings are going to determine your behavior and drive your life. That you become aware of the feelings more like an observer of them, and that being an observer of your feelings helps you regulate and figure out what you're going to do with them. It doesn't necessarily mean the feelings are all going to entirely disappear or go away, but you become more of an agent of your own life and behavior when you become aware of what's happening to you inside yourself. And that relates to also being able to rethink what those feelings might mean to you. And that's another important processing of moral distress, is rethinking, well, okay, maybe as I thought Khadijah especially articulated, maybe this isn't a disaster, maybe this is a way I can learn something. And next time I don't have to respond this way. I might respond in a different way that's better for the person I'm working with and for me. And those moments of silence and reflection are really crucial for the processing of the kind of emotional stresses and strains that crisis work just makes it really hard. And I think that sense of personal agency over your own inner life is also a source of hope, because it gives you a sense that the future doesn't have to be the past. Often when we're totally stressed and can't get out of the exhaustion and hole we're in, we feel like it's just going to always be that way. It's going to be inevitable. And being able to determine that, no, it doesn't have to be that way. I can respond differently. The feelings may not change, but your sense of observation about them can give you alternatives to your automatic responses to those feelings, which is often where we get into difficult situations. And we are also able to make more proportional responses. I also appreciate, a number of you mentioned both physical spaces, but also just time spaces where you don't have to carry everything from the end of your work cycle with you. I've actually, when I used to drive a car, I don't own a car anymore, so I use mass transit, but when I drove a car, sometimes I would put a particular soothing kind of music on my car player to help me get calm down. I find singing helpful, so I don't sing in public, but I do sing in the shower and in my car and places like that. And putting on music that I could sing to was helpful. And then, or sometimes just being silent in your car and breathing. And now that I ride I haven't ridden mass transit lately, but I do walk a lot of places that I need to go to in my neighborhood. And occasionally I do ride the metro very carefully. Doing those things, I have found listening to music on my phone, or even to sounds. I have a Calm app that I can use that gives me the sound of the sea or birds or rainfall. Just the sound in my ears is also really calming and helpful to me to make a transition space in time, if it isn't in physical space. But I will say that my indoor plant garden has quadrupled in the last 3 months as I keep adding things I want around me that have been my version of gardening is potted plants, but that is also helpful, I think, too. And there's something particularly wonderful about beauty, whether it's having a flower bloom on your balcony or walking in the trees along the park in a city that is also quite wonderful and soothing. But the risk of not doing these things, of not doing this kind of self-care and making sure the people that work with you also find ways to do self-care, is that you can descend into the state we call moral injury, which is when you start to self-isolate and lose your capacity for empathy and become unable to climb out of that space, so that you sink deeper and deeper into it. And it's a kind of emotional pain that can lead you to using substances in ways that drugs or alcohol to help you cope with the pain, because you don't want to feel the pain. And it can make you descend into a kind of cynicism or despair about what life is like for you. The world needs you, especially those of us who do pastoral care. The world really does need us right now. And that means that we have to do self-care. It's really, really important. So those are just some of my reflections on what I heard. I don't think I can top the wonderful strategies and experiences and advice that the panelists have offered. So I think, Al, I'm going to turn it over to you so you can pose some of the chat questions for us. Unmute.
Thank you. There's a few chat questions that may not have already been answered, and so I just want to lift some of them up. It's Eileen that tells a story that she's a law enforcement chaplain, and reports that she's getting first responders and healthcare workers saying to her, some of the most frequently asked questions is, how do I remain empathetic but don't take those things in myself? So panelists or Rita, do you have thoughts you want to add to that feedback, or something that still remains maybe unanswered there?
Well, I would say, for me, a lot of times I have a few chaplains that I can go to and talk things out with them and sort of share the weight, and and vice versa for them. Sometimes they are also sharing with me, and it's more a peer support. So that's really an outlet that I have for that.
One of the things that works for me really well is that I have always framed the work that I do in ministry and chaplaincy as a gift someone is giving me, that I am being gifted by being allowed into their lives at that time. And for me, somehow, by transforming it from this is my job, this is my role, this is my responsibility, it takes a burden off. And I can always take the package that I have been gifted and set it aside. And that has always really been helpful.
I'd like to add to this conversation and perhaps bring in another question. In one of the mental health concepts that I find really helpful is critical incident stress debriefing. And I use a trauma therapist specifically for this purpose. Somebody asked about friends wanting to know how you're doing, and sometimes you just don't want to talk about it, right? You just want to be with your friends and see something else going on in the world. I can't stress enough that having someone who is dedicated and prepared to listen to you so that you can rid yourself of the detritus of the day and the moral injuries that we are incurring. Let's be honest about it. That's specifically geared toward that. I find enormously helpful, and frankly, I would not be able to do the work that I'm doing without that kind of asset. Thank you.
Thank
If I
you.
could just say that I try not to be empathetic. I can't know what they're doing. I'm not a clinician per se. I can't know everything. But my body language and my reputation to folks is that I'll listen. And so almost anybody will stop me in the hallway, you know, Khadijah, you got a minute? And I listen. And I don't say, oh, yes, I understand. I don't give them any of those platitudes. I understand. No, I hear you. Is there anything you need right this minute that I can help make a difference? And so, you know, it's not trying to do this. It's what can I do right this minute?
Thank you. Thank you. Teresa asked the question of everyone. She reports first, I've experienced pushback and shutdown of conversation when I've reached out to nurses to check in on them. I work from home most of the time. It seems to me that this is their way to cope by not giving into their anger, fear, and stress. Do you have thoughts for her?
So to go along with that, you know, I try to offer a lot. Like we try to have a support group for staff and mindfulness activities, and very few people actually take advantage of it. And I think part of it, it's a symptom of compassion fatigue. I think people are more comfortable being like, I'm just going to use this as a term of status quo. It's safer. It's where they're at. It's just a lot of effort to go anywhere else. And to recognize that and be patient and gentle and meet people where they're at and just know that. So just to let yourself be available, and when the time is right, maybe they'll come to you, and just be patient.
I think a small objection to the way that question was phrased is I would not assume that the reason why people aren't sharing, and maybe asking some of your nurse peers about that reason, or what is the reason that they're not participating. And also when you call, to ask if they have time to talk. So many people, nurses, all of us, right, have productivity expectations and just want to get through the day. So that notion of humility really plays in here.
If I could just say real quick, sometimes, like when I had to assign staff to work in different units, and I would be calling the nurse manager to verify the assignments. And they would tell me, and I kept it very busy. And then I'd say, by the way, I hope you're doing all right. You know, you can always call me or so-and-so. And they'd go, oh, thanks a lot, you know. And I didn't intrude on their schedule or time. I let them know I was there. And I let them know that we were listening and paying attention to them. But if I didn't get the indication that this was a good time, I didn't try to make it about me, because bottom line, it's not about me. So I sent me on a vacation, because since the rest of me couldn't go, I sent me on a vacation.
Can I go on a vacation too?
Oh, yeah.
And those baked goods, for the baked goods, I would like to go for those.
Yes, carrot cake and apple cake. Yes, I'm giving us a request.
So just GPS directions, please.
Yes.
I would just tag on to that to say that just keep being present with them. And, you know, sometimes you, in a roundabout way, you can just admire the fact that they are very resilient and strong, and say, I don't know how you do it. Every day you can come back with the same energy. And sometimes they'll appreciate the fact that you're appreciating that, and then they'll also say, well, I don't. It's a mask or whatever, but but it is it's a sacred thing they're handing you, because they're handing you their image, they're handing you their role, they're handing you, so it's not something they're just going to go, oh, there's a chaplain, here you go. But if you're there with them every day and you're appreciating what they do, and vice versa, they'll appreciate what you do, kind of thing. So, but don't worry, just be patient and be there for them when they're ready for you to be there.
Well, our time. Rita,
I was just going to say the other is that I think when people are in a crisis situation and they're working in emergency ways, they to stay focused on what they're doing is really important, and it's distracting. It can be distracting to have to think about how they're feeling in other ways, so because someone isn't going to talk about how they feel in a work shift doesn't necessarily mean that they don't need to process it. It just may be at that moment they don't want to stop. That it feels like it would be overwhelming to them to have to stop and reflect on how they're feeling. And I have a colleague at work that just in situations sometimes when they have a code and someone actually dies, she actually just asked the team that worked on the code to just pause for a minute and just breathe, and say a little prayer over the person who died, and thanks for the team that worked so hard, so that they can move on to the next one in the way that Clif himself described, these little short, where am I right now moments, without them having to go into how they're feeling. It's just a moment to feel their feet on the ground and stop a second.
Thank you, Rita. We're just about going over our time. It's been such a powerful experience, but there's one question I just wanted to leave to have you just respond if you wish to, as our closing conversation. How about breaking the rules safely? There was a question about how about safely breaking the rules. So do you have any thoughts about that as we have that as a final brain teaser or a thought around serving and helping?
You know, I've had staff say, well, how come I have to do it this way or that? And I would say that is one of the tools we're being given to give compassionate care. And rather than go against what you may see as the rules, how do we embrace them so that we can be present or do our job well? I work with a lot of people in different roles in healthcare, and I don't usually advocate, well, yeah, you can break the rule a little bit. Sometimes it's there for ways that you just can't see. So how about embracing it as opposed to pushing against? Because I have found, especially when a family is in a situation someone is dying, that made all the difference when I asked them, what is the best way to provide for your loved one here? And then figuring a way to make it work, as opposed to, well, you don't have to do it this time. That's just been my experience.
Thank you. Anyone else? Well, good food for thought. We thank you all for signing in today to be a participant, and we particularly thank every one of the panelists for your candor, your genuine compassion, your response, and for the work you're doing every day to make the world loving and compassionate and caring. We thank everyone for being with us today. Rita, do you have a closing thought?
No, I just want to reiterate that I thought it was just a great session, and I hope that we've all learned something about how we can support each other in this work together. So thank you all very, very much.
Thank you.
All right. Bye, everybody.